What vaginal discharge says about your health, especially after 50. The shocking truth about your vaginal discharge: what your body is trying to tell you. If you've noticed changes in your vaginal discharge, don't ignore them. Your body is constantly sending signals about your health, and vaginal discharge is one of the most important indicators, especially as you age. After 50, hormonal changes, menopause, and potential health issues can all influence the color, texture, and smell of your discharge. Some changes are completely normal, while others could signal infections, hormonal imbalances, or even serious health conditions. So, what's normal, and when should you be concerned? Let's break it all down so you can take control of your health with confidence. Understanding vaginal discharge and its role in women's health. Vaginal discharge is a natural fluid produced by the cervix and vaginal walls to keep the vagina clean, moist, and protected from infections. It plays a crucial role in maintaining vaginal health by flushing out bacteria and dead cells. In your younger years, estrogen levels help regulate vaginal discharge, keeping it relatively consistent. However, after 50, menopause leads to a drop in estrogen, which can significantly affect the amount and type of discharge you experience. How menopause affects vaginal discharge. Menopause typically occurs between ages 45 and 55 and brings several changes to vaginal health. Decreased estrogen levels lead to vaginal dryness, reduced discharge, and thinning of the vaginal walls, making the area more prone to irritation and infections. The pH balance of the vagina also changes, creating a less acidic environment, which increases the risk of bacterial and yeast infections. Additionally, the vaginal tissue becomes thinner, which can cause discomfort, burning, and a higher likelihood of infections or unusual discharge. Some women experience an almost complete absence of discharge, while others may notice changes in texture, color, or smell. What different types of vaginal discharge mean after 50? Clear or white discharge is usually normal and indicates that the vagina is self-cleaning. However, if it becomes thick and clumpy, resembling cottage cheese, it may indicate a yeast infection. Yellow or green discharge could be a sign of bacterial vaginosis, BV, trichomoniasis, or another infection. If accompanied by a foul odor, itching, or burning, medical attention may be necessary. Brown or bloody discharge might be leftover menstrual blood if you are still perimenopausal, but it could also indicate uterine polyps, fibroids, or even cervical cancer. Any postmenopausal bleeding, even light spotting, should be checked by a doctor. Gray discharge is a common sign of bacterial vaginosis, often accompanied by a strong fishy odor. This condition typically requires antibiotic treatment. Watery discharge can be normal, but excessive amounts may indicate hormonal changes, sexually transmitted infections, STIs, or even gynecological cancer. Thick, sticky, or mucus-like discharge could be due to hormonal fluctuations, but if it has an unusual odor, itching, or pain, an infection might be present. Common vaginal health issues after 50. Vaginal atrophy, also known as genitourinary syndrome of menopause, GSM, occurs when estrogen levels drop, leading to thinning, drying, and inflammation of the vaginal walls. This can result in dryness, burning, pain during intercourse, and an increased risk of infections. Vaginal moisturizers, estrogen therapy, and lifestyle adjustments can help alleviate symptoms. Bacterial vaginosis, BV, is an imbalance in vaginal bacteria that often results in gray or yellow discharge with a strong odor. It is usually treated with antibiotics and probiotics. Yeast infections occur due to an overgrowth of Candida fungus. Symptoms include thick, white discharge, itching, and redness. These infections can be treated with antifungal creams or oral medications. Sexually transmitted infections, STIs, such as chlamydia, gonorrhea, and trichomoniasis can still occur after 50. Symptoms may include yellow, green, or foul-smelling discharge. Regular checkups and safe sex practices are essential for prevention and treatment. Gynecological cancers, including cervical, uterine, and vaginal cancer, can cause abnormal discharge. Bloody, brown, or watery discharge after menopause should be immediately evaluated by a healthcare professional. How to maintain vaginal health after 50? Staying hydrated helps maintain natural moisture. Vaginal moisturizers and lubricants can reduce dryness and discomfort. Practicing safe sex by using protection can help prevent infections. Avoiding douching is important, as it disrupts natural bacteria and can worsen infections. Eating a healthy diet that includes probiotics and estrogen-like compounds found in foods such as soy and flax seeds can support vaginal health. Regular checkups, including pap smears and pelvic exams, remain essential even after menopause. When to see a doctor? You should seek medical attention if you notice unusual colors such as gray, green, or dark brown discharge. A foul or fishy odor, pain, itching, or burning sensations, blood in the discharge after menopause, or frequent infections are all signs that warrant medical evaluation. It is always better to have unusual symptoms checked sooner rather than later. Your vaginal discharge is a window into your health, and after 50, paying attention to these changes is crucial. While some variations are completely normal, others may signal infections, hormonal imbalances, or even serious health issues. By staying informed, practicing good vaginal hygiene, and seeking medical advice when necessary, you can maintain optimal vaginal health and overall well-being. Medical disclaimer. This article is for informational purposes only and should not be taken as medical advice. If you experience unusual vaginal discharge or other concerning symptoms, consult a healthcare professional for an accurate diagnosis and appropriate treatment.